Senate Health Committee, led by its chair, Senator Jackson Mandago, has today visited Kenyatta University and the Kenyatta University Teaching, Referral and Research Hospital. I beg your pardon. Now, as part of the process, issues recently raised by the student leaders allowed to access the hospital as part of their training. Eliud Mutweri tells us more in this report.
The Senate Health Committee earlier today toured the facilities used by Kenyatta University in training medical students as it listened to the pleas of the university management, which wants to be granted permission to use the Kenyatta University Teaching, Referral and Research Hospital for training.
You have seen there's no school, no department is together. So our students have to go to Kiambu, all the students, and share the amount of money we have been using, the time that the students have been actually spending unnecessarily, all that actually make it so difficult. We want to maintain quality medical education, and we are feeling that is what we have been denied.
The university's Vice-Chancellor, Professor Paul Wainaina, who had raised issues of the hospital's management taking over its facilities, told the committee that the university is capable of running the hospital and it had a clear plan to do so.
And we came up with a plan, a business plan, which actually we took to Treasury, and the Treasury bought the plan. And the plan was we were going to actually run the hospital, and in the 4th year, we were going to break even.
Afterwards, in the afternoon, the committee was led to the Referral Hospital. The senators inquired on why the university is not represented in the hospital's management board and why the initial plan, which was to allow the hospital to house the University Medical School, was not implemented. The alleged initial plan was signed by the current Referral Hospital's chair of the board of directors, Professor Olive Mugenda, when she was the university's vice-chancellor and Professor Wainaina was her deputy.
And all of a sudden, we don't see her in the board. I think now it's a question for Kenyatta University to answer why it's not consistent with its board appointments of its representatives, and why they keep changing, the transitioning their medical representatives on this board.
The core matter in that petition is about the access of Kenyatta University medical students to use this facility in their learning. So we've just made a visit to the university just to familiarize ourselves with the facility itself, and also get submissions from the university and also from the hospital board and management. That is exactly what we have done, and as a committee, we cannot comment more than that until we conclude our report and make our submissions to the House.
The Referral Hospital, which now offers specialist development training for medical practitioners, has blamed the university management for not following protocol to seek approval from relevant government authorities to use the hospital. Professor Mugenda, responding to the question why the hospital is offering training programs, says that it has been legally mandated to do so, while raising concerns of disagreements between her and Professor Wainaina, although she indicated willingness to collaborate with the university.
He was my deputy for 5 years, and we had no problem at all. So if it is because of the hospital, I left the hospital for 3 good years. I went to do other things until I was recalled for using it as a bait to have the hospital back. I think those are the questions also, with a lot of respect, you have to ask yourselves. Because if with these 6 months, when we wrote the MOU, because that was the idea, and he signed the MOU, we signed together. That time there was no problem. Why did he take that MOU in 2020, write to the medical board, ask for they become accredited? All these things would not have happened, honorable senators.
Senator Mandago has urged both institutions to hand over supporting documents to the committee by Thursday this week to speed up the petition hearing process. The proceedings led by the Senate Health Committee intend to resolve the issue that will allow Kenyatta University health students to access the Kenyatta University Teaching and Referral Hospital for their training. Mutweri Eliud, KUTV.